Hi, my name is Sasha Cahill, and I am a founder and CEO of HealthInfoMap. HealthInfoMap, we use artificial intelligence to track patients through care continuum, figure out what is the true cost of care is, and then make a very targeted recommendation to care providers as to how to reduce the cost of care and improve the outcomes. Well, before we dive in, let's talk about the cost. First of all, we all know that as care providers, that the profit margins are decreasing year after year. But in the same time, the waste in healthcare keeps increasing. And then, of course, there is a push from the government and from the patients and from other stakeholders to create transparency tools that will show the cost as well as the outcomes and how the two are connected. And of course, we'll know that by the end of 2018, over 50% of Medicare payments will come from alternative models. Well, why are these problems not being solved? First of all, we all keep hearing about big data. Well, it's not really about the big data, it's about small, actionable data. But it's sort of difficult to address if in healthcare we store data in various depositories and we don't have tools to consolidate and harmonize the data. And then, of course, there is another problem. How can we truly decrease the cost of care unless we truly know what it is? For a very long time, unlike in any other industry, in healthcare, we actually haven't been calculating the cost. We have been estimating the cost, and there is a big difference. We've been looking at the reimbursement and then sort of guesstimating what we should charge the insurance company. Well, that clearly doesn't work very well. And then on top of it, in order for you to decrease the cost and improve the outcomes, you need to not just maybe change the way we look at the cost, but also to connect the outcome data and make recommendations that are actionable and make sense to care providers. With that being said, I would like to talk about the tool that we have created. We work with care providers, existing clinical, operational, financial, and general ledger data. So we can integrate in any EMR, then we harmonize the data, and we make actionable recommendations on how to improve the cost of care and how to improve the outcomes. How do we do it? First of all, at the heart of what we do is a completely different way to calculate the true cost of care. We use what it's called an ABC approach. It stands for activity-based costing. It's actually have been around for tens of years and have been used in every single industry but healthcare. Activity-based costing requires for us to not just know exactly what the supplies and resources that are being used during care delivery, but with respect of the time that those supplies are being used. Here I have a couple of examples. So you can see, if you look at the MRI of pelvis, the difference between ABC costing is about $200. And we also go further. We present the costs and as far as they go for each physician. So we look at the supplies and resources that each physician use. We also then consolidate the data with the outcomes. And then you can drill down and you can actually see what are the areas of opportunities for each particular physician. Our company is an interesting stage. I've spent a couple of years. We've done a pilot. I intentionally chose a small care provider in Mooresville, North Carolina. And after doing a pilot there and after provider was able to implement our suggestions, he saw a quite significant revenue boost. For him, it meant to over $130,000 in 12 months. And then we spent quite a bit of time also validating our MVP and go-to-market strategy. We had presented to Athena Health, worked with their data, and it was quite successful. So we actually currently talking about channel partnerships as well as licensing of our tool. And we actually last week brought on board our very first paying customer. Our company has been funded by its founder, me, and at this point, we're looking to do a couple of seed rounds and to expand our team and also to onboard more customers. I am Sasha Cahill, the CEO and the founder of this company. I have over 10 years of project management, also research and development, and building tools for provider, payer, and PBM markets. I was part of the team, co-founding team, and I was able to um, we were able to win Amazon Innovation Prize. And my CTO, James Dalton, he's actually a US Navy veteran. He's also a senior AI developer. On our sales side, we have Jeremy, who's specifically focused on bringing to market tools for provider and for payer market. And our advisory board is actually larger than this, but three people that have been with us for the last couple of years. One of them is Bill Inman. He's known as a data of warehousing. He's a four-time CEO founder, over 30 patents, 3 exits, including publicly traded company. He was named one of the most significant people in the computer science in the last 40 years. And Paul Davis, he's our quality healthcare officer, and his background is clinical as well as computer science. And Bill Saunders is our chief data science officer, who his entire career he spent doing data analytics in the healthcare space. Our go-to-market strategy requires for us to work with single and multi-specialty care providers, as well as surgery centers and accountable care organizations. But we hope that bulk of our revenue will be brought through licensing and channel partnerships, hence our partnership with Athenahealth and our ongoing conversations with Allscripts. We have multiple ways to generate revenue, including long-term, we would like to sell data by query to pharmaceutical companies and insurance companies. And before I finish, just would like to stress is there is a way to decrease the cost of care while improving the outcomes. But we have to look at the problem from a different angle. And that's what I believe HealthInfoMap has for the market. There's a different angle, different solution, and a targeted information that could help. Thank you very much for your time. We have a couple of models. We focus on single and multi-specialty care providers, surgical centers, and ACOs. We have currently 6 customers that we negotiating agreements with. Our very first paying customer is intentionally chosen as the smallest out of the 6. It's a podiatric clinic in South Florida. So the specialty to us doesn't matter, and our focus is intentional on small and mid-sized care providers because of their short sales cycle. We offer for them a model where they pay $1 per patient per year, usually, but that model, if it's a large ACO group, it's negotiable. We have also a second model based on the savings. We can generate an agreement where we will get to keep a portion of the savings. Did I answer your question? It's a really good question. Actually, it's very interesting. Yes, ABC has been around for a long time. However, ABC for healthcare is quite new approach. In a matter of fact, the only other large competitor we have that truly has the capability to integrate difficult data sets is called Health Catalyst. And I actually met with the CEO co-founder at HIMSS. However, our market focus is on small and mid-sized care providers, so we're actually discussing channel partnership. But in reality, we don't have many competitors that do they look at the care continuum and follow patient through care continuum, not just through a department. But I want to stress, we do ABC costing for patients that go and we look at the full cycle of care. And that's our main differentiator. So yes, we also have it on technology. We have separate IP that structures difficult data sets. We also have a separate IP that works with clinical data sets, like textual data sets as well. So in terms of IP, we do have a lot of differentiated factors as well. But our methodology, our approach is also quite different. So I have relationship with, I've negotiated relationship with a patent attorney from Penwick that worked among all clients. She actually specializes in digital health, but she also has Facebook as a customer. And we are patentable. However, I'm looking to close our first seed round and then pay her to finish the patent work. So we're just in the early stages of that. The textual ETL technology that we do have, that already has a patent. It's a great question. Yes, for sake of sales cycle and for sake of generating revenue, yes, we're go-to-market strategy will require for us to work with small and mid-sized care providers, and an ACO and surgical center would be the largest among all. However, in the next 18 months, I'm actually looking through our channel partnerships with Athena Health, Allscripts. We're in the very early stage conversations with Cerner as well. So the true value from our software can be delivered if we work with large hospital groups. So at this point, I start, again, there are partnership conversations. And at this point, I'm also looking for a pilot in the large care organization. But in terms of go-to-market strategy, that's going to be probably a year and a half to 2 years. Mhm. Yes. Yes. And we know that as well. Thank you. And that's why, yeah, that's not our current focus. Any other questions? Hmm. The target market is on the size of care provider, not necessarily the geographic location. I am based in Charlotte, North Carolina. However, I'm in San Francisco area every single month. I'm looking forward to the time when we can actually raise some money so I can be here full time, less travel. That would be wonderful. But also, we actually have quite a, so look here a little bit. Here we go. Our advisory board here is not complete. I recently brought in a very powerful advisor. He had built a company, $5 million company, to about $100 million company. And Michael is very well known. He's based in Nashville. As a matter of fact, probably our first seed funding will come from Nashville. So I wouldn't be surprised that the bulk of our customer will be company southeast, probably southwest of first customer base. But because of our channel partnership with Athena, I also foresee us in the next 12 months to be all over the United States because they're interested in licensing our tool. Thank you. I appreciate your time. Thank you.
Okay.